Hello, this is Mark L. White for Health Hacks. Today we are lucky to have Dr. John Leonardo with us. And Dr. Leonardo is up in Canada, and I was reading your bio, and I see you do a lot of stuff in sexual wellness, hormone optimization, aesthetics. And one thing that kind of stuck out is you were the first doctor to be trained on how to do the P shot. I thought that was very interesting.
In Ontario specifically.
First doctor in Canada or in Ontario?
Ontario.
That's still cool. You're taking it up to Toronto.
Absolutely.
So tell us, Dr. Leonardo, you have a practice. You've been practicing now for 14 years?
So I finished residency in 2006, graduated from medical school in 2002. So just do the math. So it's been over 20 years since I graduated from medical school, but in practice for about 17 years independently.
It's funny when I talk to Canadian practitioners, because you hear about the public healthcare system in Canada, and you don't see too many Canadian doctors getting into regenerative treatment. So you're kind of a pioneer up there.
I am. The thing is, my medical education is actually all in the United States. I'm American. I moved up here in 2013 for a chronic pain management position, and I've since become a dual citizen. But because I'm American and I'm here in Canada, I kind of get a sneak peek of what's happening below the border. And I was one of the first people to bring PRP into the Toronto area. We weren't the first, but I was aware of it as early as 2007 when I was working as an anesthesiologist in New York City, working with orthopedic surgeons. And that's how the door kind of opened to the P shot, prior shot. And I looked for further training with PRP, and came across Dr. Runnels.
So you journeyed down to Alabama.
Yes.
How was that coming from the north?
So the flight actually got canceled, and I was like, oh my God, this may not happen. And I was rerouted, and I made it to training after about, I missed about the first hour or so. And they're aware that my flight was delayed, et cetera. But it was one of the best training experiences that I ever had. And I told Dr. Runnels that the education and the hands-on segment were just crucial and vital to my success.
And why did you choose to do this all up in Toronto? Is it just a decision to take it to a new market, or you have family up here?
No, I had actually no connection to Canada. It's just that I was living in New York City with my spouse. We had twins, and there was no way that we were going to raise them in New York City. It was just a little bit too cost prohibitive. And I conducted a job search all throughout the United States for anesthesiology positions, and they were all pretty much the same. And I decided, you know what, let me take a look outside of the US. And I found this position right outside of Toronto. It was a chronic pain management position. And as a US doctor, we think that the Canadian doctors are starving up there. But this was actually the best offer on the table, and took a leap of faith, packed everything up and moved. And I'm just so much happier up here in terms of lifestyle and the procedures that I'm doing.
It'd be interesting to know, like, because you've been in both systems, you hear American doctors saying, well, Canada, you have all these issues. And then you hear Canadian doctors saying, God, I would never want to work with the FDA. Like, what was the differences owning a practice up there that was in private pay medical and age management? Were there, like, what's your version of the FDA there?
So it's Health Canada. And I feel that they micromanage a lot, right? Where in the United States, I still maintain my New York State license. So I'm actually flying back to New York City this weekend to do a couple of cases and some training. But anyway, as a physician in the United States, I have pretty much free liberty, to do all sorts of procedures. But in Canada, particularly for Ontario, the College of Physicians and Surgeons of Ontario, they kind of micromanage a little bit too much in terms of if you want to do Botox and fillers, you have to run it by them. Okay. Where in the United States, I'm a doctor. It's like they have faith in me that I'm going to use my medical education to, practice well and safe.
So when you get back from Alabama and you are now the first guy doing PRP shots in Ontario, how did that discussion go? Getting on the board, saying, you know what, we're doing this thing, and it involves PRP and injecting the penis. Like, was that a fun conversation?
Well, the medical director, the owner of the chronic pain management clinic, he's the one that actually supported me in this, and we wanted to bring it on as an additional service. And we didn't know what to really make out of it because I was the first. And, it was pretty amazing how things developed, where the first year when we would answer phone calls, we'd have to explain what PRP was and the procedure that we were doing and our goal. And then by the next year, people were asking for it by name. We didn't have to, give them an education on PRP. A lot of the potential clients already came educated. And even now, it's a lot easier.
And I see you're also doing cosmetic treatments. You're trained by a good friend of mine, Dr. Alan Ballman, who's down here in South Florida.
Yes.
So you get people coming in for hair and for sexual wellness. That's an interesting combination.
Yeah, I do a lot of different services, and a lot of it stems from PRP. So in terms of erectile dysfunction treatment, it's PRP, and also for hair. When I trained with Dr. Ronalds, he taught me how to regrow hair with PRP. And I thought, oh, this is, the best that it's going to get, until I came across Dr. Bauman. I'm actually a instructor for Empire Medical Training. Pre-pandemic, I would fly down about every other month or so to teach their Botox fillers and aesthetic PRP courses. And that's when I ran into Dr. Bauman. He gave a lecture on hair regrowth. And I kind of picked his brain about one patient that didn't really respond well to my therapy. And then he was picking my brain, like, did you eliminate the risk factors? What risk factors have you identified? What's your protocol? What centrifuge are you using? And he was like, I'd really encourage you to come down and take a preceptorship with me. At the time, I was like, oh, no, I'm good. I know what I'm doing, right? And then the more I thought about it, I was like, you know what? I could really benefit from his expertise, because he's seen over, I guess at that time, he's seen over 18,000 patients and had been doing it for about 18 years or so. And I went down there, trained with him in Boca Raton. And my protocol, I just believe, is the best in Canada, right? Everyone's going to think that they're the best, but I have the evidence, with my before and afters that I post on Instagram. And I do it differently than anyone else. Mine is a one and done approach. All right. A lot of these clinics, you have to keep coming back for a series of 3. But my patients don't repeat their PRP hair treatment for about a year, year and a half, sometimes 2 years. And that's the same thing with the PRP shot, right? It is a one and done approach. Sometimes we don't see the patients until 2 years. I'm like, well, how did it go? It's like, absolutely wonderful, but I'm back for more. So the beauty of it is all related to the centrifuge that we use and the protocol.
That's great. And you also do the O shot. What percentage of your patients are men versus women? Do you get a lot of couples coming in?
We do. All right. So in terms of aesthetics, facial aesthetics, I would say that it is 70% women, 30% men. In terms of sexual health, it's more 90% men, 10% women, just because I offer a lot more services for the male patient in terms of performance and enhancement. For the women, I don't know, maybe sometimes they want a female practitioner or so, or sometimes my female patients transition from facial aesthetics to sexual wellness, knowing that I do that. And we do get a lot of couples, which is fantastic. And, to hear back from them saying that they feel like teenagers all over again, and, I've really spiced up their sex life. That's wonderful.
So it's funny, you probably get these women that come in for their face doing this aesthetics, and you're like, by the way, can your husband be better in the bedroom? And the next thing you know, they're bringing them in, the best
Pretty
clients.
much. Like a lot of my clients sometimes are like, they're like all sheepish, like, oh, I have this stupid question. And then it's like, just go ahead and ask. I was like, oh, you know what? I have a solution for that. I happen to provide this service. And a lot of times people are just afraid to ask. And just have to be willing to take any question that they may have.
In sexual wellness, I know you added GainsWave. How has that been doing, either alone or in combination with the priapus shot?
It's fantastic. It's a great service. I love combining it with the priapus shot because I just believe that everything works better in combination. We have two great therapies. They have their strengths. And then when we combine them together, you get the best of both worlds. So I like to use them together.
Now, you see a lot about regenerative medicine, at least down here with mitochondrial, like with stem cell therapies and with exosomes. Has that made its way up to Canada?
It tried, and then Health Canada shut the door on it. So for about a year and a half or so, they've pretty much shut down anything stem cell related, with the exception of research. So our pain management clinic was actually approved to do research with stem cells. We're comparing stem cells harvested from adipose tissue versus iliac crest bone marrow.
Mhm.
And they're allowing us to study that. It's still in its initial phases right now. But yeah, we'll see what happens from there. And hopefully, depending on the data that we get, maybe we can extend this over to sexual health. But right now, it's kind of in its infancy.
Now, you mentioned something before the show. You're doing a lot of groundbreaking stuff when it comes to stuff probably a lot of guys could be interested in, which is using treatments to not just make sexual wellness better, but to actually increase growth.
That is correct. So a lot of guys, when they inquire about our services, they'll first mention erectile dysfunction, and then when you delve deeper, they don't really have ED, and they have more of a concern about their size. And before, there was really nothing that you could offer, but with P-Shot, we found that guys generally obtain a growth of about 10 to 20% in length and also girth. So we have that service. But I've also added off-label uses for dermal fillers and also neurotoxins. All right, so with dermal fillers, most people use an HA filler, but I prefer a product called Radiesse. It's calcium hydroxyl apatite. It is not you, but it becomes you because it stimulates your body to form collagen. And I actually contributed a chapter in a textbook all about calcium hydroxyl apatite and my protocol. And that was about 2 years ago when that was written. And my protocol has changed. And I believe that I have made it better with a hybrid of both calcium hydroxyl apatite and also HA. Again, I love things in combination. It takes on the best of both worlds, where you have the collagen stimulation of Radiesse, and you have the bulk of HA, and it's also dissolvable. Radiesse is typically not, but we have a nice safety net in that it's dissolvable with the hybrid. So dermal fillers, it's straightforward. Okay, we just plump up the penis based on desire or budget.
This episode is brought to you by GainsWave. If you're a guy who is not achieving optimal performance in the bedroom, and you've tried the pills and you've tried the shots, and you're looking for an all-natural way to boost blood flow in the penis, GainsWave is evidence-based and proven. Go to gainswave.com and find a provider near you. So if a guy wants to grow more, he has to buy more
Absolutely.
HA. So what's the most you've ever pumped into a guy's penis?
Oh my God, I have lost count with this guy. I think over 40 syringes, not all at once. This is pretty much staged. And every 2 months or so, he keeps coming back. And we've increased his girth to about 2 inches. And the reason being is that his wife had 3 children through vaginal delivery. And it was easier for them to have the husband augmented versus tightening up the wife. And they're having a great sex life now, just because there's no longer that size mismatch. But it's like 40 syringes and counting, and he's coming back. I've seriously lost count with this guy.
So when you do a treatment, how long are the results? Is it permanent? Is it 6 months, or they have to keep coming back every few months?
So it's not permanent. All right. So most HA fillers, depending on how it's processed, can last anywhere from 6 months, 9 months, a year, sometimes longer. Okay. Radius typically lasts about a year, year and a half or so. If you take histological slides, you'll see that the product is still around for over a year and change. However, what we see, typically it's going to need some topping up every so often. So if we did an augmentation on a gentleman and we just let the product just naturally degrade, I would say most of it's going to be gone by about a year, year and a half or so. But what they're going to see, they're going to notice that, okay, maybe I'm back to baseline at about a year. Okay. So we do an initial bulking. All right. We do 2 stages, separated by 2 months apart. One, just to lay the product down. During the procedure, sometimes you don't know if it's product or swelling. All right. So when they follow up and all the swelling has resolved, we'll take a look. And a lot of times it's perfect. Sometimes there might be contour irregularities. Okay. And if that's the case, you go on to the second stage just to even out the contour or just to add more bulk. So typically I'll start with about 7 syringes of filler. That'll give you about a 1/2 inch girth increase. And then by the second stage, if we're using the same volume, they're going to be able to achieve about a 1 inch girth increase. And this is for the average male erection, about
That's
5.
circumference or diameter?
This would be circumference.
Wow.
Okay.
And then, so lengthwise, what do you see?
So lengthwise, we don't get that from the filler. It's more for the P-shot. So if a patient is concerned about length, we have to do P-shot first just to optimize that length before we fill. Also, another one of my procedures is neurotoxin for the penis. So there have been many articles about using Botox to improve erectile function. I'm probably the first person to use it for the indication of shrinkage. Right? There are muscles that kind of cause the penis to turtle head in some guys more so than others. So with Botox for the penis, it allows the penis to relax longer in the flaccid state. So if you're one of these growers that have lots of shrinkage, it is mandatory that you are treated with the Botox prior to your augmentation, just so that the penis hangs longer. And there's less of that accordion effect, because if the penis has filler and we have that shrinkage going on, you're going to have contour irregularity, right? But if we allow the penis to relax in the flaccid state, we don't get that quite so much, right? So the penis is relaxed, and then we have filler on top of it. It's going to hang a lot better. So these guys actually say, I feel hung now, right? So it's great in combination.
Does it affect, I would think, like sensitivity wise, though, there'd be some effects on sensitivity when you think of Botox?
No, not really. It's, Botox paralyzes or relaxes muscles temporarily. All right. So our target here, in terms of the corpus cavernosum, is a smooth muscle there. It creates a low pressure system to allow for better blood flow. And they've done studies where there's actually an increase in blood velocity after penile Botox. And it also allows the penis to have residual blood. So you're always kind of in a perpetual state of a chubby, so that it's not as retracted. All right. So it doesn't really interfere with sensitivity.
It was like the, do you remember Seinfeld back in the 90s, the whole episode on shrinkage?
Absolutely. I did an Instagram post with that with George Costanza. And, like most guys with shrinkage can relate to that. There is a lot of embarrassment in terms of how one is perceived actually in front of their friends in the locker room situation versus their sexual partners in bed. And this is called locker room syndrome. And Growtox, Botox for Growers, that's the trademark.
Love that name, by the way.
Thank you.
Growtox,
So
Botox for Growers.
Botox for Growers. So it addresses locker room syndrome. And the reason being that it's a problem for guys is it affects their self-worth, right? They're there with their buddies, and if they got a lot of shrinkage, that's how their friends view them. They don't see them erect, right? Their sexual partners do. And a lot of times these growers and showers end up about the same erect length, but you would never know because you don't see each other erect, right? So it's really a point of embarrassment for a lot of guys that suffer from shrinkage.
Well, do you get more guys coming in for the radiance treatments, or do you have them coming in, like, is shrinkage really, like, do you have a lot of guys coming in for that, or is that a huge market?
I would say that it is a huge market. A lot of guys just aren't aware that there is treatment for it. So a lot of guys find their way to me because of ED treatment. And while they're at the office, sometimes they'll pick my brain, or I'll say, I noticed that you've got a lot of shrinkage going on. Is that something that you would want to address? Because I have certain therapy that can actually improve this.
That's funny how it comes up, like, no pun intended, but like, how do you
but you know what? And then some of my patients, like, I'm so glad you mentioned that because it does bother me, and like, you just say it matter of fact without any kind of judgment, just like any guy that's coming in for therapy, whether it's Peyronie's or erectile dysfunction. You've got this fragile psyche right in front of you, and if they're already embarrassed about it, the way that you handle it could crush them. So it's just very matter of fact, and it's like, I'm here to help you, so you should feel free to discuss anything with me.
Well, that's it's a great niche, and I would think in Canada you don't have as many doctors really talking about sexual wellness. So you're definitely on the forefront there.
Yeah, so Canada's a little weird as well in terms of advertising, because I'm not allowed to advertise, oh, I'm doing these services, like in the United States, where you can, have an ad on television or radio. We are not allowed to do that. It's really frowned upon. Some clinics do that, but I'm sure that I would get a lot of complaints if I had a radio spot advertising about penile augmentation. So we kind of have to dance around getting clients indirectly without doing an email blast or a mailer because it's frowned upon by the college. So a lot of people come to me through my Instagram account, Leonardo Medicine. That's where I post a lot of my before and afters in terms of aesthetics and everything else that I do.
You show the before and afters on the Growtox there?
So I can't. All right. So there's certain ways that I kind of dance around it. In terms of penile augmentation, I will blur out the background or the skin. I'll have tape measure before and after. You can see that, one guy grew about 1 inch in girth, or that one guy 2 inches, right? But it's all blurred out. On my website, www.leonardomedicine.com, I have photo galleries. You just have to scroll down and agree to seeing the adult content, and then you can see the before and afters, unedited, uncensored.
Plus, you're talking to all the women that come in for the aesthetics. I'm sure a lot of them would like to get their partners in.
Yeah, you know what though? Sometimes that could be a struggle, because even though the female partner is all excited about it, The male partner is like, not so enthusiastic about it.
Or the female partner is not too enthusiastic about it. So
The strange thing about the male clients that come in for augmentation, I would say half of them do not want to disclose anything to their partner that they're getting a procedure for augmentation. I have this one gentleman that comes in and he times his procedure with his wife's menstrual cycle because they're not sexually active during that time. And it allows him to recover from any potential bleeding, bruising, swelling.
is there a lot of downtime with it? Like when they get the procedure, they have to go a few days without sex?
So in terms of P-shot, really no. But bear in mind, you have 5 injection sites that make you susceptible to any kind of bloodborne infection, whether it's HIV or hepatitis, right? So practice safe sex if you don't know your partner's medical history. In terms of the fillers, same consideration in terms of infection, but I'll tell my patients no heavy masturbation or sex for about 2 weeks. I want the filler to really settle into place. I had one guy who absolutely loved his work. And then 5 days later, he wears his biking shorts and he's cycling, I don't know, 100 kilometers or so. And then all the filler had shifted, right? So that was clearly something I did not want, right? So just rest it for about 2 weeks. In terms of penile Botox, there's really no downtime other than just the injection sites as well, in terms of infection.
So what's next? What's the next big thing coming up to Canada?
I don't know. I'm still working on these and promoting it, but on the horizon, I'm not too sure. I think I'm pretty cutting edge right now.
Well, that's cool. No, I appreciate your time on the show. So if anybody's listening to this and they want to learn more, they just go to leonardomedicine.com.
Correct.
And they can see the before and after pictures. The inventor of Growtox, I'm going to try to get this right. Botox for Growers.
Correct.
You're the guy. Do you have other doctors that you've trained?
I do. I've had providers come up from the United States, and I will teach them all of my tricks in terms of penile augmentation. Depends on what they want to learn, and I can create a course for them tailored to what they want to learn, and they take it back with them and they can practice pretty much immediately. The trick about penile augmentation with fillers is that you have some providers that are adept at injecting the penis, and you have some injectors that are great with fillers, but sometimes not both. All right, so it can be very tricky. So I've had one provider that does lots of penile treatments like circumcision, vasectomies, didn't know a thing about fillers. So in preparation for his course, I had to bring him up to speed in terms of the science behind the gels and safety techniques, et cetera. And then for the aesthetic injector that is not familiar with penile anatomy, it's just about educating them and kind of blending that science with art so that we have a great product.
Well, it's exciting. You could take this to the masses and get everybody to learn about Growtox, because I think
hope so.
Combating shrinkage 1 inch at a time.
Yeah. And then I'm actually more active on my Instagram, Leonardo Medicine. I post pretty much on a daily basis, and I try to make things interesting. I'll do facial aesthetics one day, and then maybe sexual health another day, and sometimes pain management. So that's where you're going to see a lot of my day-to-day posts and what I'm up to.
So check out Dr. Leonardo's Instagram. We'll have links in our show notes, leonardomedicine.com. I really appreciate your time, doctor.
Thank you for having me.
Thank you so much.